Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I do a lot of body contouring surgery. I do a lot of liposuction. I went down to Colombia a couple of times to learn with really the world's foremost master of high-def liposuction. I was one of his best students, actually. I've done a lot of this sort of work. I do a lot of safe liposuction. That's an acronym for a certain kind of liposuction that has been popularized by a surgeon down in Louisiana. Both of those procedures promote skin tightening and allows me to contour you instead of just removing volume. Any of these procedures, the number one thing is to do it safely, and that's very technique dependent, and it's also decision dependent. A lot of patients ask me, Dr. Shapiro, is there a limit to how much liposuction that I can do for you? And the answer to the question is yes. I won't do more than 5,000 cc's at one time, which is roughly about 11 pounds. And why that is that our society, the American Society of Aesthetic Plastic Surgeons and the American Society of Plastic Surgery, mandates that you really shouldn't do more than 5,000 cc's at one setting. And when there is more than 2,500, 3,000 cc's, we often like to have you stay overnight in a facility so we can watch you. So we want to make sure that this is a safe, relatively riskless procedure for you. Anything can always happen in surgery, and you know that. But really good decisions are to make it safe for you so you get a great result and you don't have any untoward problems. You know, what are the problems that could happen? You could have a pulmonary embolus, you could bleed, you know, all those sort of things that you read about. But all in all, I think that 5,000 cc's at one sitting is really what you should limit. That's not to say that I can't do 5,000 cc's and then do 5,000 cc's later, but you kind of have to ask yourself, is this really a candidate for liposuction? Now, the good thing is that liposuction is shown to decrease insulin needs in patients. It helps with diabetes. So there are a lot of medical benefits from liposuction, but really, primarily, it's an aesthetic procedure that gives you a much more contoured result that makes you feel and look prettier. But there are limits, and good sense dictates that we really shouldn't do more than 5,000 cc's at one sitting. It can be done in stages, and I very infrequently will do that, but occasionally I have. So the best way to find out what kind of liposuction, whether it be standard basal liposuction, safe liposuction, basal high definition liposuction is for you, where it should be done. It should always be done in a facility. Whether or not you need to stay overnight, these are all decisions that involve you in terms of telling me what you're looking for, me trying to guide you in a direction that's going to make you happy, it's going to make you feel as though I've given you a great aesthetic result, and most importantly, it's done safely. So the best way to find out whether you're a candidate, what kind of liposuction we should do, and talk about how much we can do at one time, come in for consultation, and we'll go from there. Thank you.